Home to over 500,000 people, living in 17 municipalities and 2 chartered cities, the province of Surigao del Sur is found at the northeastern coast of Mindanao, facing the Pacific Ocean. Fishing and farming are its people's main sources of livelihood. Once ranked 6th of the 10 most impoverished provinces in the Philippines, Surigao del Sur's health system was in disarray.
If you're a family or a person or a pregnant mother living under poverty line, paano ka magbabayad doon? It's very expensive. Although we were considered as one of the poorest provinces several years ago, but that doesn't mean that we should deprive our poor constituent to good health services. On the contrary, we should improve our health services. Day in, day out, I meet 20 to 30 people, indigents, poor people asking for help. And karamihan yan is because their hospital bills, medicines, almost 80% are health-related. Every day sila nakakausap ko eh. Walang pambili ng gamot, kailangan ng dugo, walang pambayad yung sa hospital. There was one time a 9-year-old pumunta sa office ko and then humingi ng tulong dahil nakagat ng aso. Pin-injectionan natin, but I learned na after 2 days namatay din kasi yung rabies nandun na sa kumalat na sa katawan.
Governor Johnny Pimentel remembers the incident to this day. He felt guilty. Rabies is a curable disease, and the child should have lived.
Why health? Because I have always believed that is the frontline services. 30% of Filipinos die without even seeing a doctor. I don't want that to happen in the province of Surigao del Sur.
Even when he was still the provincial administrator, Johnny already focused on the health issues of Surigao del Sur. The province faced 2 major problems: high maternal mortality ratio and underutilized hospitals. Surigao del Sur recorded its highest maternal mortality ratio in 2005, 300 deaths per 100,000 live births. This is significantly higher than the 2015 Millennium Development Goal. 77.5% of expectant mothers preferred giving birth at home.
We found out the bed occupancy rate of our hospitals was only under 70%, meaning the people do not go to our hospitals. We made an ocular inspection and we found out that the hospital facilities were all dilapidated already. They were undermanned, there was no medical equipment, there were not even ambulances.
Something had to be done immediately. The capital began by securing a 32 million peso loan from the World Bank for the construction of additional facilities and hospital wards. 17 of the 19 rural health units in the province now have birthing facilities. All 8 hospitals managed by the provincial government can deliver quality maternal health care as certified by the Department of Health. The capital set up halfway houses for pregnant women from far-flung areas. Built beside birthing facilities with 2 bedrooms, a bathroom, and a kitchen, the women stayed in these shelters until it is time for them to give birth. This has helped reduce maternal deaths in the province.
Mag-family planning na kamo. Kaya malisod kong 12 ang bata. Kiniininduha, pwede pinidugangan.
As with all projects, a steady stream of funds is needed to sustain the delivery of health services in the province. Being a businessman, Governor Pimentel knew that a single source of financing, like the internal revenue allotment, would not be enough. Even if their budget allocation for health had been increased from 7 to 17%.
Normally, in any provincial government, all the income of the hospitals is deposited into the general fund. Now, once it is deposited into the general fund, Meaning kahit na sinong pwedeng gumamit niyan. Ang nangyayari tuloy, sometimes they need medicines. They have to buy dextrose. They need funds for the food, for the patients. Hindi kagad nabibigyan ng pera kasi nagamit na ng ibang department. But this is healthy. You cannot say you have to wait. If we need dextrose, you have to wait for 1 week. You have to wait for 2 weeks.
The capital came up with the Income Retention Program. Each hospital's revenue from the sale of drugs and medicines and reimbursements from PhilHealth would be its own, no longer part of the province's income. The monies become a revolving fund. Each hospital would remit the income to its own trust fund.
Because of our accreditation with PhilHealth and because of our payments of PhilHealth and because the coverage of PhilHealth has widened, they buy their own medicines. They buy their own medical equipment. In fact, one hospital bought their own additional ambulance.
The results surpassed everyone's expectations, particularly Governor Pimentel's. When the scheme was enforced in 2005, the hospital's collective income was 7.6 million pesos. By 2011, it reached 37.7 million pesos.
So now, they have their own operational expenses. However, meron kaming safety measures so that it will not be subject to abuse. You can only use the trust fund for purchase of medicines, purchase of medical equipment, and the hiring of technical staff, meaning doctors, medical technologists, nurses only. All the purchase should still be approved by me.
The second highest income earner among Surigao del Sur's health facilities, Bislig District Hospital has capitalized on the paying market. They constructed air-conditioned private rooms so that those who are able to pay can choose to be confined there instead of the nearby private hospital. This has helped raise the hospital's income. To breathe life into its dying health system, Surigao del Sur's provincial government came up with innovations on fund sourcing to make hospitals self-sufficient. They fixed the dilapidated and mismanaged provincial hospitals. With more stable finances and health facilities, the quality of services improved.